Hello everyone, my name is Mujala, the founder and host of the Self Evolution podcast. So today we'll be having an interesting topic, something that we all know but we're just not sure about, or we don't have the actual facts and details about. So today I'm here with a male nurse who is also an HIV specialist who goes by the name of Mr. Sakala. So Mr. Sakala, how are you doing?
I'm very fine, and how are you?
I'm okay, thank you. So today he's going to tell us everything we need to know about HIV. Well, for me, I at least know that HIV means human immune virus. That I know. So today we just know everything, all the details that we have to know about HIV. So Mr. Sakala, can you explain what HIV is and how it's transmitted?
Thank you very, very much, and thanks to the viewers and the audience that is listening to this interview. To start with, like I've been introduced, I'm also Sakala, an HIV nurse practitioner or HIV specialist. So, what is HIV? HIV, this is an abbreviation standing for Human Immunodeficiency Virus. So this is a virus that basically attacks the immune system, and then when the immune system is attacked, you have that infection, then it gives way or paves way to a lot more other infections that will make somebody go into a state of AIDS. So HIV in its own is just an infection that we acquire, and we may not have any signs and symptoms at all until we reach a stage of AIDS. In a nutshell, that's it.
Okay, so for how long does it take for it to reach that point of AIDS?
So from the time the person is infected with the virus, it may take as long as 15-20 years, depending on a lot of factors. One could be nutritional status, the other one could be the lifestyle of the person, the other one could be exposure to other diseases and conditions that may make the immune system to be weakened further, then you allow other infections. So in the early stages, you have a situation where after infection, the body will start responding to the invading virus. So by then, because your body is still strong and able to fight off infection, you have a rapid rise of viruses in the body, which we call viremia. So if we are to do a viral load at that point, you find that you have a lot of viruses in the initial stages, because at that point, the body will have not yet developed the immune system or the protection against that virus. Then that protection is in form of antibodies. So the antibodies are triggered by way of something provoking the body to respond to such invading organism. So in this case, you have the CD4 cells that will carry the antibodies that will fight off, to try and fight off the virus. So in that initial phase of less than 3 months, you have a rise in the viral copies. But after the body develops the antibodies, then the viruses will be suppressed and go into hiding. But while it's in hiding, they continue multiplying. Yes. So it takes a bit of time for somebody to start showing signs and symptoms that they might have HIV.
Okay.
Above all, we cannot tell who has HIV, because everyone looks as healthy or as ill looking as any other person. Not until we do the test.
Okay.
Yes.
So what are the symptoms of HIV and how can people identify them?
All right. So for the signs and symptoms of HIV, there are quite a lot. You cannot just single out one to say this one looks like they have HIV. The only way you can tell that somebody has HIV is by way of doing an HIV test. Because an HIV test will now tell whether somebody is HIV positive or HIV negative. And those that are HIV positive, then you start relating to what they are presenting, what they are complaining of, to be related to HIV infection. But in the initial stages, when somebody gets infected, there is what we call acute HIV disease signs and symptoms, or acute HIV infection signs and symptoms. But these again, they mimic other infections such as common cold. Somebody will have a body temperature that is rising, somebody will have flu-like symptoms, a headache, a cough. That is in the initial days of infection. But it does not mean that when somebody feels like that, they have HIV now until we do a test.
Okay, so it's only by testing that you will know your HIV status. So if you don't know your HIV status, please go and get a test. Make sure you know your status. Okay, so how is HIV diagnosed and what are the testing options available?
All right. So the diagnosis of HIV is dependent on an HIV test, and we have what we call antibody test. We also have a molecular test that detects the actual viral genome or the actual presence of the virus. So depending on your resource setting or resource availability in your setup, you might wish to start with the antibody test or the viral test. So the difference is that for the antibody test, you need to test somebody who has had the infection for at least more than 3 months. Because in a period before 3 months, it's a period we call window period. In this period, you find that the person will not have the antibodies that will be detected by the rapid test that you need to use. So even if somebody got infected last week and you tested them, the result using the antibody test may come out negative, which may not be a true negative. So when you do a rapid antibody test, it is a time when you test negative. If it's for the first time, then we'll allow you to go and come back for the retest after 3 months, so that we are sure of the body having developed antibodies towards an invading virus. If you test negative after 3 months and there has not been any exposure, then you are negative. But if we are doing a viral test, which is a molecular test, which could be nucleic acid test, abbreviated as NAT, or which could be polymerase chain reaction test, which is abbreviated as PCR, you may need to do it even within a week, slightly 7 to 14 days. It may give you a true result, because that one will test the presence of the actual virus.
Yes. So what is viral load and why is it important in HIV management?
So viral load is simply the number of viruses or the viral copies that have been identified or picked in a meal of blood. So it is important because, one, it helps us know that the person is indeed HIV positive.
Yes.
Again, it also helps us to know that the person has either been on treatment, which is ARVs, or has not been on ARVs. It also helps us to assess the effectiveness of our treatment that we are giving to somebody who is HIV positive. And then it also helps us to identify whether we are dealing with what we call treatment failure. So if the virus is, despite being subjected to ARVs, the number is not reducing, then we start suspecting that our medicine is not working effectively. Yes.
So can HIV be prevented, and what are the most effective ways of preventing it?
All right. So HIV prevention is actually very much attainable, and it's attainable in a way of number one, for a young generation or adolescents, which is from the ages of 13 to somewhere 23, we encourage that these people practice abstinence. So abstinence is 100% assured prevention, because there will be no any contact of some sort. So if abstinence fails, then we encourage safe sex practices. Under safe sex practices, we encourage people to use condoms.
Yes.
Consistently and correctly. Don't use a condom today, then tomorrow or the other time you have an act, you don't. No, you have to use it every time and correctly.
Yes.
Thirdly, we encourage that people use PrEP, which is pre-exposure prophylaxis, by way of using antiretroviral drugs.
Yes.
As well as PrEP.
Okay.
So that's how we can prevent HIV, and then avoid illicit activities that will expose somebody to HIV, such as having multiple sexual partners and use of drugs either injectable or those that you can take by mouth.
Okay.
Yes.
Is it possible for one to test themselves for HIV?
Very much possible. We have an antibody test, which
Mm.
we call OroQuick, which is an HIV self-test kit, where somebody gets and they do that test in the comfort of their home.
Okay.
And if it retains a positive result, then they have to visit the clinic, either where they got the test
Yes.
or any other facility with that test that is
Okay.
showing a positive result. Then at the hospital or clinic, we repeat the test. We start from the rapid test using blood,
Mm-hmm.
and then we also do a confirmatory test,
Okay.
which is antibody based. Yes, but for the oral quick, you don't need blood, you just need saliva.
Oh, okay.
Yes, so it's done by way of wiping through your mouth.
Okay.
Yes.
So, and how do you know? How do you read the results?
So for one to tell the result whether it's negative or positive,
Yes.
when it's negative, it means you don't have the virus at that particular point.
Mm-hmm.
So on the test pad, if you're using the antibody test, there are two lines that appear there.
Mm-hmm.
There's a line that should always be there that will give us a sign to say the test strip you're using is working.
Mm-hmm.
Then the other line that should appear there, if at all it should appear or it
Mm-hmm.
appears, it's a line that tells us whether you have the virus, the antibodies are detected or not. So if you have two lines appearing on your test pad, it means you have the antibodies that are as a result of the presence of the HIV virus.
Okay.
If you have one line, then it gives us an indication that you are HIV negative, and those appears only on antibody test strips.
Okay.
Yes.
Seeing that USAID has stopped um helping us with the treatment, ART or ARVs, so what are the best ways to stay up to date with the research of HIV?
Okay, thank you so much for that concern. I know it's a concern that a lot of people are now raising.
Yes.
Yes, so to start with, USAID has not stopped the support.
Okay.
Yes, what they have done is they have just suspended certain activities
Okay.
that are in the bracket of USAID HIV/AIDS relief
Yes.
activities. Yes, so currently the programs that are under support
Mm-hmm.
prevention of mother to child
Okay.
transmission of HIV, cervical
Yes.
cancer screening, antiretroviral therapy support has continued in terms of supply of ARVs.
Okay.
Yes, and all these other emergency or urgent activities.
Mm-hmm.
So going forward, it is an opportunity for us and scientists across Zambia
Mm-hmm.
and those in the region to research further and start developing strategies and identify avenues that can help us start to discover our own antiretroviral drugs, so that going forward we try and minimize over dependence or over reliance on external aid.
Okay.
Yes, so it is an opportunity that opens other doors as well.
Mm-hmm.
Yes, but at the moment there shouldn't be panic to say the supply towards ARVs or HIV/AIDS services has been halted. It's still there.
Oh, okay.
Yes, and it's still under review.
Okay.
Yes.
So when we have our counselors go out there to test people, how sure are we that they don't test the same people over and over again? Because there's been a rise in the number of HIV cases. So how sure are we that those are new cases, or those are cases that have already been tested and that are already in the system that they have HIV?
All right. So for the counselors that we work with in
Yes.
the HIV/AIDS management,
Mm-hmm.
these are people who are trained. So they are trained to talk to people, identify people that require an HIV test, then offer an HIV test.
Mm-hmm.
Yes. So when somebody is tested for HIV,
Yes.
yes, there could be sporadic cases of people wanting to retest because when they did the test, they were told, no, actually, you are doing fine on treatment.
Mm-hmm.
And we have not seen any virus, which takes us back to the viral load.
Yes.
So when you do a viral load and you discover that it's target not detected, it doesn't mean that you're HIV negative. It just means that you are taking your treatment effectively and the free circulating viruses are reduced. So there are people that feel if I do an HIV test when my viral load is low, I'll test negative. They do appear. Then we also have new HIV cases, quite all right. So to confirm or counter that, we subject such kind of new clients to what we call recense testing. So recense testing is a test where we confirm the HIV infection, as well as give indications whether the person has been with HIV for a long time or it is actually less than 3 months.
Okay.
Yes. So if it is identified in those angles, then we don't usually give those results to clients.
Okay.
But it's for our own understanding and our own mapping of where we're having a lot of new HIV cases.
Oh, all right.
Yes.
How can Zambia maintain its progress in HIV treatment and prevention without US aid funding? Let's say if they were to completely stop funding us, what then would Zambia do or African developing countries do?
All right. So in the context of Zambia, I'm not speaking on behalf of anyone.
Okay.
Yes. I'm speaking to something that I feel should be done.
Yes.
And it's something that maybe the Minister of Health has even started implementing.
Yes.
So one of it is targeted HIV testing. Why targeted HIV testing? This will help us save the resources because the HIV test strips are bought at a high cost.
Okay.
So we cannot just test each and every person that want to be tested.
Yes.
We have to confirm and make sure that indeed this person is at risk of acquiring HIV test, has not been tested for HIV recently, and is not a person who is on ARVs. So we need to have a skill of identifying somebody who is eligible for an HIV test so that we save the few resources that we may have.
Yes.
The second thing is at policy level in government, where we now need to shift some resources from other areas of less need to the fight of HIV and AIDS. Because when you look at the issue of mother to child transmission of HIV, it is being targeted highly so as to have a generation that is free of HIV infection. So if we neglect such kind of a program, it means we may start having a lot of babies being born with HIV. So if we become more targeted in the way we are managing our resources towards HIV AIDS prevention, HIV and AIDS management, then we can save and use it prudently.
Okay.
Even the giving of ARVs should also be done in a way that we are sure that the people we are giving are the rightful beneficiaries and not just to give each and every person.
Yes.
Like currently, if we talk of PrEP, our target for PrEP is now towards pregnant and breastfeeding women, those who are not sure of their partner's HIV status. So we are encouraging that we focus the PrEP activities towards such kind of a population.
Okay.
Yes.
Okay, just to take you back on the question on viral load. So if your viral load is suppressed and let's say they say you have 0 viruses, yes, you said it doesn't mean that you are now negative, but you've just been taking your medication effectively. So how can you put it in the way that is it possible to infect other people if your viral load is suppressed?
Thank you very much. So for viral load to be suppressed, current studies show that it should be less than 1,000 copies per mil.
Okay.
So if you have 900 copies per mil, 800 going down up to 0, which is target not detected, it means you are virally suppressed.
Yes.
So chances of transmitting are there but minimal for someone who is virally suppressed, and there are copies that are freely circulating. For somebody who's virally suppressed and target not detected, chances of transmitting are very, very, very minimal.
Okay.
Yes. But that does not mean that somebody is HIV negative.
Yes.
It only shows that you are doing fine on treatment and the medicine is working well, and chances of you transmitting to another partner should you have risk activities such as sexual unprotected sexual intercourse, chances for you to get the virus are very, very, very minimal. And in a situation where you have a couple, a discontent couple, where the other person who is HIV negative is virally suppressed and target not detected, we encourage that the person who is HIV negative may not even require PrEP.
Okay.
Yes.
Okay. So despite achieving the 95 to 95 targets, why are HIV cases still rising in some areas such as Lusaka? Because every time there is a report, just like according to the Zamfia 2021 report, a lot of cases were coming from Lusaka. So why do we still have a lot of rising cases from Lusaka despite achieving the 95 target?
Okay. I don't know whether you allow me to elaborate on the 95 first so
Yeah,
that
sure,
we
sure.
can have an understanding.
Yes.
So currently we are talking of the 395s, which is 95%, 95%, and 95%. So the first 95% is that all those people that are living with an HIV out there, 95% of that population should know their HIV status
Yes.
to be positive. Then of those that are tested positive, 95% of that population should be put on treatment.
Treatment.
And of that population on treatment, 95% of that population should be virally suppressed.
Okay.
So why are we trying to push for that? We are pushing for that which is achievable, so that chances of reinfecting others are very, very minimal and reduced to near zero.
Yes.
So that we don't have this to continue being a public health burden. Then we still have a few cases like in Lusaka, where we are still recording new HIV infection. It could be from a pool that is still unaware of the HIV status.
Yes.
Then the other issue is that, Lusaka is a cosmopolitan place. It's a capital city of Zambia. And due to urbanization, we have these people that are time and again coming into the district, into the province, to try and fight and try to improve their living standards.
Yes.
We also have people who are at risk, people like young girls, girls in schools, in colleges and universities. These are people who are taken advantage of and are being abused by different people.
Yes.
Because a person wants to either compete with a peer or try to get something out of it.
Yes.
They start indulging and having transactional sex, which puts them at high risk. So by way of Lusaka being a capital city and a cosmopolitan place, we have mixed races, mixed people from all different backgrounds, who in its own way puts Lusaka as an epicenter, if so to say, in terms of HIV infection because of these activities that go around.
Okay.
Yes.
Since we still have people out there that are not aware or that don't have the information of HIV, so how can we ensure that everyone is aware of the preventive measures, PEP, PrEP, ART, ARVs? What measures are being put in place to make sure everyone is aware of HIV?
So to make sure that HIV information is aware, is well spread, Ministry of Health through partners, that's the non-government organization, the USAID itself, there has been a lot of sensitization programs that have been drawn up, flyers, radio shows, television shows.
Yes.
The platforms such as this one,
Yes.
where issues are discussed and shared. Above all, we have gone further to even train non-medical personnel to even go into workplaces, share the information, and give it out to each and everyone.
Okay.
Added to that, all HIV-related services, including preventive messages, are free in all government institutions.
Okay.
So a person can walk into a facility, a health facility, ask about HIV-related issues, and they will be helped and attended to accordingly. Yes, so for prevention and measures to make this activity of HIV and AIDS prevention go out to the public. There are a lot of platforms that people can still look out for and visit any health facility that they feel to visit.
Yes.
Or indeed get in touch with you.
Okay.
And then you may give them directions and addresses where they can still find help, because issues to do with HIV and AIDS are usually done in a more confidential and private manner.
Yes.
Yes. Just like any other medical related issues.
Okay.
Yes.
Okay, that being said, let's make sure we protect ourselves, prevent ourselves from being infected. Let's make sure we reach the target of the 333.99%. Okay, we know that the weather has been fluctuating. Today it's cold, today it's hot. Let's not make this an opportunity to indulge in different activities. Instead, let's make sure we become productive and make sure we have value instead of indulging in various activities. Make sure you keep yourself safe. Make sure you're out there sensitizing people on the importance of HIV treatment and so many different things. So, for those who would like to reach you, how can they reach you to know more about HIV?
Okay, so for people who want to reach out to me, number one is visit my workplace, my workstation. So my workstation is along Kafue Road, Charles J. Nyirenda Hospital, just before McKinney Roundabout. If you're coming from town, it's on your right. If you're coming from Chilanga direction, McKinney Roundabout, you pass, just check on your left, you'll see written Charles J. Nyirenda Hospital. There you come, you'll find me. You can ask for Wilson Sakala, or you can ask for the nursing officer there, then somebody will show you, and then we'll discuss in a more private and confidential manner.
Okay.
For the contacts, I'll leave it up to that. I think the presenter, the moderator, will have to share it on a platform that is ideal for that.
Okay. So if you want to know more about HIV, if you have any further questions, or if you want people out there to know more about HIV, feel free to reach out to us. You can follow us on our Facebook page, the Self Revolution Podcast. Don't forget to like and as well as subscribe to our YouTube channel. I've been your host, Mbuya Mujala, and I've been with Mr. Sakala. Today has been all about HIV. Stay safe.
Thank you.